Thank you very much for waiting. Now we would like to begin the keynote lecture session. First of all, I would like to introduce our speakers for keynote lecture. The speaker for the keynote lecture 1 is Dr. William Sander, Associate Professor at the University of Illinois, One Health Illinois Center and the Department of Veterinary Clinical Medicine. The second keynote speaker is Dr. Abhi Sarkar, Head of Office at the UN Habitat Laos. The third keynote speaker is Dr. Shunsuke Managi, Distinguished Professor and Director of the Urban Institute at Kyushu University. The fourth speaker is Dr. Motoyuki Sugai, Director of the AMR Research Center at the National Institute of Infectious Disease, the Japan Institute for Health Security. Now I'd like to introduce our moderator for this session, Dr. Tatsuji Nishihara, a One Health Education and Research Promotion Advisor for Fukuoka Prefecture. Following the keynote lectures, we will hold a general discussion with all our speakers. We welcome your questions and encourage you to participate through the asking questions. So, please refer to handout in your packet titled How to Submit Questions. Just simply scan the QR code corresponding to each lecture to post your question. If you wish to ask more than one question, multiple questions, please click Submit another response that will be shown on the screen on the confirmation screen after each submission. Your question will be shared and discussed during the Q&A session. So we look forward to your active participation. For the online participants, please use the link in the video description box to submit your questions. Now, I will turn the floor over to our moderator, Dr. Nishihara, to lead the session. Dr. Nishihara, the floor is yours. Good afternoon, everyone. I'm Tetsuji Nishihara. So I would appreciate your cooperation and participation.
Thank you very much for your attending of this conference. And first of all, I express many thanks in the morning, Jacqueline Kito, for the nice presentation. And then we are very interested in your talk. And then we can understand Kenya's stories, and then we have to do in Japan all the same time, okay? Thank you very much. Anyway, we'll start this conference. I will be chairing the presentation of this conference, and then first speaker, as a moderator, introduce you, Dr. William Sander. Please take on the stage. We have enough time for discussion, so please hear her presentation, his presentation. Please, Dr. Sander.
Thank you, arigato. Good afternoon. So I want to thank the organizers for this event. It's been my pleasure and honor to be here, and I'm very happy to talk a little bit today in the time I have about this overlap between sustainability, climate change, and healthcare and practice. We heard this morning from Dr. Cthulhu about the overlap and the ramifications of climate change and health. And so I'm going to expound on that a little bit more, explore that a little bit more here moving forward. So the goal in healthcare, I'm going to talk about both from a physician side and a veterinarian side, even though I'm a veterinarian, is under sustainability, we want to think about how do we maintain high quality care with resilience and capacity to respond to the escalating number of climate-induced demands. At the same time, we need to mitigate our own substantial contributions to the climate crisis. So this is the underlying goal of thinking about environmental sustainability and healthcare. And so how do we get to that point? So to provide a little background on this, we know obviously that the Paris Agreement was signed in 2015, and the goal was to keep global warming under 1.5 degrees Celsius. And then the UN Climate Change Conference in 2021 really explored how much does the healthcare profession actually contribute to greenhouse gas emissions and carbon emissions in general. And the goal is to try and get healthcare to zero emissions by 2050. And since then, we've had over 100 human-centered organizations have declared climate change an emergency. And we know globally that the healthcare system contributes about 4.4% of all greenhouse gas emissions, so not insignificant. And coming from the US, we like to be #1. And so in the US, our healthcare industry contributes about 9% of greenhouse gas emissions from the US. And we already are the biggest, as a country, the biggest greenhouse gas contributor. So it's really significant. And we also know that there's a lot of concern at the same time about, do healthcare professionals know the contribution our industry has in this space? And by and far, physicians, veterinarians, nurses, technicians generally don't. And so this is a big challenge for us to think about how do we move that forward. And then additionally, we're talking about urban environments here, and we're talking about under this increasing pressures from impacts from climate responsive hazards in cities, whether it's extreme heat or severe weather, flooding, cyclones or hurricanes. We rely a lot more on the pillars of our cities to respond and mitigate and adapt to these things. And one of those pillars is obviously healthcare organizations. They can help provide education and advocacy. They can measure and provide data on health outcomes, and obviously provide health services. And our cities provide social programs and policies that help protect their citizens and the patients that are in the community, and provide local climate projections, and obviously provide a lot of the infrastructure we need around water, electricity, road access. So the two together play a pivotal role in trying to deal with this challenge moving forward. And so although a lot of healthcare providers don't necessarily recognize the impact that healthcare profession has in this space, there is renewed interest. And a lot of, we've heard about the World Medical Association, the World Veterinary Association, recognizing the challenges that are going on here as far as affecting our patients, but then also how we are impacting the overall larger picture. And so in the US, where I'm coming from again, the healthcare industry there contributes about 546 million metric tons of carbon dioxide equivalents. And obviously, like I said, about 9% of greenhouse gas emissions. And so a study from Eckelman in 2020 talked about the fact that this equates to about 388,000 disability-adjusted life years, and that's just in the US, so really significant. And we also know there's not a strong correlation between how carbon-intensive our resources are utilized in healthcare and the health outcomes we get on the other side. So there's a big opportunity for improvement. The clients in the veterinary space and the patients in the human healthcare space really value this, and there's been a lot of study work looking at what are the opinions of the folks that we serve, and appreciate the climate change relevance to clinical care. So within the veterinary space, we have surveys now finally showing that a majority of clients want veterinary practices to have a sustainability component, to the degree that an overall majority, about 70% of or more of staff in veterinary clinics and healthcare facilities overall want to work at environmentally sustainable practices. Which makes sense, right? It fuels into this larger mission of trying to take care of everything around us. Additionally, we know that people in cities, a majority of them, feel that they would benefit from increased opportunities to engage with, appreciate, and understand the natural world. So these two things kind of coalesce together here to be a great opportunity moving forward. And then at a larger level, in workplace cultures, we think about this ideology-infused psychological contract. And this is real in employment settings if the employer can match its values with the employees, it really creates a lot of long-term benefits. And it actually accentuates measured value for employees and makes the working more sustainable long-term. Additionally, we know that with environmental sustainable practices, they oftentimes need a champion or a leader, and so that's just another opportunity for staff to become, rise up and become leaders in those fields. And I have a public health background as well, and so one of the things we talk about a lot in public health is the social and ecological determinants of health. And these are really broad pieces, right, that fall into this space. And we need to then overlay this about how human-caused changes in our climate are affecting these pieces of social ecological determinants. In the US, we deal a lot with racial discrimination, and 43% of our population is considered a racial or ethnic minority. And we know from studies in the US that these groups have associated poorer health outcomes, higher infant mortality rates, higher blood pressure, and access to lower quality health care. And globally, we know that air pollution reduces the global average life expectancy by 2.2 years, so not insignificant. And these all impact and drive poorer health outcomes, particularly for those who are underrepresented. So I talk a lot about sustainability rather than just climate change because it has a broader umbrella. But what is sustainability? And so I think this definition from almost 40 years ago captures this pretty well from the UN. And thinking about, how can we leverage what we have currently without sacrificing things into the future? And so I love three-legged stools. A lot of epidemiologists, which I am one of them, love three-legged stools where we talk about three different factors supporting things up. And so this three-legged stool you see up here on the slide, you can see the environmental leg of the stool on the left-hand side, but we can't forget the social and economic aspects or legs of the stool too. And I think sometimes we focus too much on, well, we can be altruistic and this is the right thing to do, the moral imperative to be environmentally sustainable, but we need to think about the other pieces. And another way to think about this is thinking about the 3 Ps, which is planet, people, and profits. Right? And if we neglect any of those 3, we're not going to have successful sustainability initiatives moving forward. And obviously, this was alluded to earlier this morning, the UN Sustainable Goals have been in place since 2015, and they've built on the Millennium Development Goals, which were established in 2000. But these can oftentimes seem overwhelming when we think about all of these problems and how do we try and tackle them. Obviously, we're 10 years into the UN Sustainable Development Goals, and so I wanted to walk through 4 pieces of this around warming, pollution, biodiversity loss, and human well-being, kind of talk about where these goals bucket into the larger picture. So for warming, we deal with these sustainable development goals. We want ideas around net zero warming in healthcare practices, about implementing and promoting decarbonization through energy efficiency, generation and use of renewable energy, and mitigating global warming and sequestration of carbon. So this is a very simple but very poignant sign, and it's extracted from Kimberly Nichols, who was the author of Under the Sky We Make. And we know the Climate Science 101 that it's warming. Our planet is warming right now. It's us, it's human caused. We're sure of it with overwhelming scientific evidence. And it's bad, but that we can also potentially fix this moving forward. So let's talk about its warming first, right? So, it's indisputable that human activities are causing climate change. I'm sure you're very familiar with the graph on the bottom left here, talking about temperature increases and changes over the last 150 years, as well as the increasing amount of carbon dioxide in our atmosphere at the same time. And this comes from the Intergovernmental Panel for Climate Change here. And we know it's bad. Climate change is already affecting every region of the Earth, and some regions more dramatically than others. Certainly when we think about the poles or polar areas, when we think about islands, we're having bigger and larger effects. And it can go from heat and drought to fire and extreme events, and even things like coral die-offs, right? And the changes we experience now are only going to continue to increase as we move forward. So I know I'm going down this really sad hole of it's bad and it's warming, but we really want to talk about why this is going on, right? So we have kind of 7 different areas, and these were highlighted earlier on some of the slides that Dr. Catullus shared and others shared too, about these impacts on health, from increased temperatures to more extreme weather events, pollution, vector-borne disease, waterborne disease, foodborne disease, and of course, mental health also being impacted. And then we have to think about those larger physical and social environmental conditions that overlay all this. And so it becomes a little bit complex, and it's certainly an existential threat, but how do we try and move this forward, and why do we need to keep this in the back of our mind? And so one of the ways that warming happens in healthcare is thinking about greenhouse gas emissions, and that's kind of the common denominator that we can use across different spaces. So in the environmental sector, we often use these 3 scopes, and so many of you may be familiar with Scope 1, Scope 2, and Scope 3 for emissions. Scope 1 is traditionally thought of as what's produced within a facility, so on-site energy production and vehicles you might have for healthcare provision, like ambulances or ambulatory trucks in the veterinary space, things like that. We also know that anesthetic gases, particularly waste anesthetic gases, refrigerants, things like that, fall into this bucket. Scope 2 is the electricity or energy that we utilize in these facilities, whether it's steam power or natural gas or whatever the source is. And then Scope 3 are often the pieces we have less control over, but they include things like procurement, like how do we get our supplies that we utilize in our healthcare facilities, what are the pharmaceutical use and waste that we create, and employee and patient commuting. So patients driving to and from our facilities, as well as our employees. And then I came here from the US, and so my business travel here on Scope 3 was quite large, right? And that's a trade-off we have to think about when we do certain things. And at the same time, these scopes vary on what type of healthcare practice you're in. So, they vary depending on whether you're in a primary care facility or whether you're in a more complex hospital system. And so this is an example from 2018 data from the Global Green and Healthy Hospitals in Latin America and Caribbean. And in urban spaces, we have a lot more of these complex hospital systems typically, and we know that a lot more of them produce higher amounts of Scope 1 emissions, which in some ways is good because we can more often control that within our facilities. And then in urban environments, from a warming standpoint, we have to think about the communities that are more vulnerable, whether it's the young or the elderly, those who are low income or facing environmental injustice concerns. These are all pieces that are systemic and have outsized impact on their health outcomes, beyond just what we do in our clinics and our healthcare facilities. And so we have to be mindful of these different components as we try and treat our patients and think about what components around social, political, economic, geographic, medical, and environmental aspects of climate change impact. In this figure, you may have seen something similar to this in the past, maybe not, but this is from BRACE, Implementation Guide, which is from the American Public Health Association and the US Centers for Disease Control and Prevention. And it's really talking about these 3 components in the center here around increasing temperatures, changes in weather patterns, and rising sea levels. And they impact things in the periphery around heat, wildfire and smoke, air pollution, health systems and services, vector-borne diseases, et cetera. And underneath each of these categories are the actual health impacts, right? And so we can see they're very wide and varied, and certainly very context dependent. And then circling all this is mental health, too, as that's impacted and creates a lot of strain, not only physically, but also mentally from the dramatic impacts. And this image is a little bit complex. It's from the World Health Organization's Health System Framework. But I wanted to at least demonstrate that there's a lot of multifactorial pieces that go into our healthcare systems. And so lots of components go into how well we can actually provide access and coverage and good health outcomes in our healthcare facilities, and climate change has a big influence in that space. All right, that's enough with complicated diagrams. Let's move on to the next piece here and think about, we can fix it. It's important. I just spent a lot of time on gloom and doom of warming, but we actually have a lot of opportunity to fix this too. So we need to limit that impact, and it needs to happen relatively soon. By now, I mean within the next decade, trying to limit our CO2, methane, and other greenhouse gases. It's a big ask, but it's something that can be done, and we have lots of strategies out there to try and tackle this. The next piece here I wanted to highlight is wildlife and nature, which is thinking about biodiversity laws. We're talking about how we conserve and enhance natural landscapes, habitats and biological diversity, and abundance of wild animal species. So this is from the World Wildlife Fund Living Planet Report from 2024. and the biodiversity crisis by region up here. And so it gives you a pretty good snapshot. Overall, there's been about 73% reduction in wildlife populations over the last 50 years, which is pretty dramatic. And this is based on data from 35,000 population trends and 5,500 species that span things from amphibians, birds, fish, mammals, and reptiles. Freshwater populations have been hit the hardest, followed by terrestrial and then marine environments. And as you can see up here, that Latin America has been hit the hardest, but that no region goes unscathed here. And the drivers, I think we all know, but habitat loss and degradation, overexploitation, invasive species, and disease shifts. The existing frameworks we have in place have been in place since about 1990, almost 30 plus years, but we haven't seen a lot of huge changes or shifts in this. And I like this image a lot. It demonstrates the biodiversity crisis kind of in one snapshot. This is just looking at terrestrial mammals, and it's looking at them by weight. And so this image captures humans, domestic animals, and wild mammals up here. And it's saying that humans and domestic mammals make up 94% of the total weight on the globe. And only 6% come from wild mammals, which is pretty startling to me, even every time I show this picture up here. It's very startling to me. And we know the benefits of biodiversity are really multifactorial. These are just some examples here around pollination, medicines, carbon sequestration, and freshwater resources. And more than 75% of global food crops rely on pollinators, and more than 50% of our medicines still come from naturally derived sources, right? So this is all playing into this space. And we're really staring down the barrel here because we know that biodiversity can be one of the best buffers for climate change. But at the same time, as we're continuing to project out what our temperature increases might be in the future, it could have dramatic impacts on how much biodiversity loss we have going forward. So for the hope piece in this one, I want to highlight the fact that this is a meta-analysis done back fairly recently here, looking at 186 studies that measure biodiversity over time and compared outcomes in spaces where they put in conservation policies and places where they didn't put anything in. And the review found that about 2/3 of cases, conservation either improved or at least didn't get worse. So that's a sign of hope, at least, that we can potentially change this path. And then getting down to a much more micro level here, it's thinking about the impact we have as trusted professionals, too. This is a screenshot from one of my veterinary colleagues who's based out of Colorado, but she goes and does work in rural Alaska and talks about conservation issues there. And this quote up here just talks about her favorite thing, the student's favorite thing was pretending to be a vet and getting to learn about veterinary medicine. And we have an outsized effect in our communities because we are looked up to and trusted. And so we can be great messengers in talking about this issue. The third piece of the triple planetary crisis is around pollution. We heard about pollution a little bit earlier, and I know we're going to talk about it a little bit later too. How can we try and minimize the usage and disposal of resources and materials and support our transition to a circular economy? So pollution is the largest environmental cause of disease and premature death. And it causes, right now, about 9 million people died last year from pollution, air pollution alone. This picture up here is from New Delhi. And it has huge connections to climate change as well as opportunities for us to intervene. It's not the end-all be-all. Unfortunately, we haven't had a lot of overall improvements. And again, coming from the US, just last week, our US Environmental Protection Agency rolled back our ability to regulate greenhouse gas emissions, which we've had in place for 15 years in the US. And we no longer have that ability because the EPA changed their regulations there. So we're not exactly an exemplar, and there's lots of challenges here moving forward about how do we control this. And it has disproportionate effects, again, depending on your socioeconomic status and who gets impacted the worst, whether it's air pollution, water pollution, land pollution. And the reason for the term triple planetary crisis is because the relationship between pollution, climate change, and biodiversity loss are all linked together. And in the healthcare space, we're not off the hook here. And when I talk to my veterinary students at University of Illinois, the first thing they think about when they think about sustainability and veterinary medicine is all the single-use plastics that we use in practice all the time. And that's one piece of it, certainly, but it is a big chunk of thinking about how do we operate in a sterile environment and minimize disease risk while also not creating a lot of pollution, too. And Scope 3 is the biggest contributor in the healthcare space, and that's what this is showing up here. This is from Healthcare Without Harm, which means we have to work collectively as a healthcare group, not just within one of our professions or the other, but really across the healthcare space. But the good news is there's a lot of excitement that can be generated to try and act in this space, too, about reducing pollution. So this is a group of veterinary students, not at my vet school, a different vet school in the US, in a big veterinary teaching hospital. And they're actually doing a waste audit, figuring out what sorts of waste items are being disposed of on a regular basis, and how can we try and better target that moving forward. And you can see they're pretty excited and happy to be digging through trash up here. Finally, well-being, I want to touch on this too, is that, it's this well-being's concern. This is human well-being, and how do we try and improve the mental well-being of people and support a transition to livelihoods and lifestyles that are fit for nature. And so I think this graphic here captures a lot of what we feel oftentimes around eco-anxiety or eco-guilt, and certainly the younger generations, Generation Z, Generation Alpha, this is kind of baked in and kind of a grounding anxiety level they have in place. We also know that climate change causes more social unrest, which impacts well-being, increases conflicts, and expands and increases human migration. And so from these, people develop psychogeriatric syndromes around eco-anxiety and climate anxiety. And this all leads to significant disruption. But there is a gaining trend towards climate hope and thinking about, this is the perceived capability to derive pathways to desired goals and motivate oneself via agency thinking to use those pathways. So really focusing on one area, doing small wins and building on that to create momentum that way. And this can be kind of a self-fulfilling prophecy that way. So these are the 4 big pieces I wanted to cover in the time I have with this before I talk about some of the solutions we can think about in healthcare as well. I don't want to just leave you with the doom and gloom of these 4 different areas and how climate change impacts it. So first, let's start thinking about necessary tests and treatments. We know from a lot of good data that up to 30% of tests, treatments, and procedures are unnecessary in the healthcare space or have low value care, meaning that they either can cause harm or the cost outweighs the benefits. So we have to ask ourselves, is a test, a treatment, or a procedure actually essential or not just routine or perceived to be expected, right? Imaging is a great example where CT and MRI are fantastic imaging modalities, but in many situations we can get by with using something like an ultrasound when appropriate. We often do duplicative lab work because we either don't have access to the lab work that was done previously, or we feel like we need to do it again because we have a different laboratory that we're relying on. And is that, again, necessary? The medical consumables account for about 20% of healthcare's greenhouse gas emissions. And this figure here in the bottom right is looking at 2019 survey data from 5 big European institutions about what proportions of the disposables fall into each category. Another place to target is optimizing medications. So I used to work for 2 years at the US Environmental Protection Agency, actually looking at pharmaceuticals in the environment. Where do our drugs go, and how do they potentially have health impacts to humans as well as animals? So how can we put a sustainability lens on this? What medications could we be using that might have less environmental detriment? Are there medications that are better metabolized by the patient so we have less being excreted on the backside? And we know, for example, that even changing the route of administration can have huge impacts. So changing medication that's administered IV to oral when appropriate can have huge reductions in greenhouse gas emissions. Educating our clients, this is notoriously a bad example for veterinarians and physicians that we don't often talk to our clients about, or patients, about where to dispose of medications afterwards, how to responsibly do that. And thinking about, if appropriate, using nature-based solutions or non-pharmaceutical treatments or interventions. Finally, one of the other pieces is substituting treatments. So how can we substitute treatments? I put this example up here first of thinking about inhalers. Metered dose inhalers are used quite frequently. In the US, they account for about 75% of all inhalers that are utilized. But they, in the US, account for, if we use the greenhouse gas emissions from those inhalers that are used in the US, it would equate to 500,000 cars on the road every year. So again, that's just in the US. So pushing more for dry powdered inhalers is an example, which is becoming more common, can be just as effective and reduce greenhouse gas emissions by 95%. Another option is how do we think about the remains from our deceased loved ones? So whether that's fellow humans or our pets, a growing trend is utilizing aquamation instead of cremation. Certainly in the US, while this is still a small fraction, it's a growing trend both for people as well as pets. And it has a far less impact on our planet than traditional cremation. Two more items I wanted to touch on here, and we'll see if I make it in the time I have. But quality improvement is one of those pieces we talk about as a generic term, I think, in all businesses, right, is quality improvement. So how do we put a sustainability slant on this? So one example is greening the operating room. So the United Kingdom put out a greening the operating check room list, greening operating room checklist that actually goes through how do we try and do changing things out, like what types of anesthetic gas we use, or reusing and sterilizing intubation tubes, for example, or how do we change our surgical packs so that we're not using whole packs, but item by item. And then you can see this example here on the right of BRACE, which is this idea from, again, the American Public Health Association and the Centers for Disease Control and Prevention about building resiliency when we're dealing with these climate issues and events that pop up. And so there's a step-by-step pattern here of how you walk through that. And then climate-friendly routine care. So utilizing telehealth and telemedicine can be tremendously beneficial, decreases the amount of time patients are commuting to hospitals and practices, or clients are bringing veterinary patients there. And they can be just as effective depending on what's going on medically. And then the Gloves Off campaign is a big push right now in the United Kingdom, and it's spreading in other areas too. And think about non-sterile gloves as a huge contributor, as well as single-use plastics, to medical waste. And do we need them, and are they beneficial? Generally, if you're not coming into contact with bodily fluids, and you're washing your hands before and after seeing patients, you don't need non-sterile gloves. And so is this a pathway forward? And on the veterinary side, we have a similar sort of campaign, thinking about the 5 moments for hand hygiene. When do you wash your hands? And make sure that you're clean in the pet space or the livestock space, and ensure that we're not necessarily needing gloves for that. And then there's some steps we can think about doing in healthcare space, doing a waste audit that I talked about in that veterinary teaching hospital earlier. So this is an example here from the Pan American Health Organization on the left, actually developing a smart hospital green checklist and assigning points to different areas. So you can go through your facility and figure out what's going on, how can I improve things. And then the waste hierarchy on the right, very similar to the hierarchy of controls, but thinking about where can we intervene to reduce the amount of waste. It's not just about recycling at the end when we dispose, but how can we try and reduce and refuse at the beginning. And so practitioners, we really need to think about educating ourselves more, and including our hospital staff as well as the general public. How can we introduce adaptive and mitigative countermeasures? And then reducing the impact of medicine through building resilience. And then promoting leadership, right? So how can we promote leadership both within our staff and within our clinics, but also thinking about more widely in the community. And then collaborating. We're at a great One Health forum right now. How can we continue that collaboration and build more synergies that way? And this is obviously going to have trickle-up effects or down effects, whichever way we want to go, about promoting welfare, health, and equity for all. So I really view this as an opportunity, much to learn from each other. Synergies are bound between our two spaces, physicians and veterinarians. We have similar aspects around delivery of care, the environments that we share, and the resources that are utilized. And so collaborating can only expedite how quickly we move sustainability through our healthcare systems. And as I talked about earlier, we really do need to expedite because the crisis is here now. So just for additional reading, if anybody wants to delve deeper into sustainability in healthcare spaces, this is mostly human healthcare focused. These are two great resources. And then I just want to close here that I want to say that I'm not an ecologist, I'm not a sustainability expert, but I've become very taken to this. And I think Sir David Attenborough summarizes this pretty well, saying that what humans do over the next 50 years will determine the fate of all life on the planet. And the late Jane Goodall, brought up that you cannot get through a single day without having an impact on the world around you. So what you do makes a difference. It may seem trivial or small, but it really can make a difference. And you have to decide what kind of difference you want to make. So the least you can do is speak for those who cannot speak for themselves. So I look forward to questions, and thank you. Arigato.
Dr. Sander, thank you for your nice presentation. And then, ただいま私の
Well, actually, I have received some questions already from the listeners. So,
I'm sorry. 10 minutes more, so you can answer in English, okay? それでは一つ目。
So first question. In the US, particularly healthcare area, the CO2 emission that represent 9% of the all carbon emission in the US. So with what kind of priority would you like to do to reduce this carbon emission? So what kind of action do you want to do to reduce or minimize the carbon emission in regard to the prioritize?
Great question about when we want to try and what actions we want to try and do. So, I think the priority, and I'll speak in the veterinary space because we're a little bit late to the game compared to the human healthcare space. But I think our priority right now is unifying a lot of our associations and groups across different areas of the US around this. So, for example, the American Veterinary Medical Association redid their climate policy definition just a year ago. And they're actually now rolling out a sustainability webinar series to all veterinarians that are free to access and get a sustainability certificate. So I think that's one step in the right direction. I think the American Medical Association has worked a lot with there's a global consortium for climate change and health out of Columbia University around developing education modules. So how can we insert more education pieces in the curriculum for medical and veterinary students? And I think that's another piece where we can really push on the levers of having long-term change.
Okay, thank you. And one more.
Well, the medical professionals, majority of them, they are aware that, well, not many people are not aware that the medicine, medical services have contributed to the, degradation of climate change. And what do you think you can do to rectify the situation?
Yeah, so how to rectify the awareness of healthcare providers, I think, is the question to the impact that the healthcare industry has on climate change. And so I think, again, some of it's coming from our patients and our clients being more aware of that. And then I think some of it, again, is coming from some of these consortiums and agreements that are happening, between at the international level with the World Medical Association and World Veterinary Association, and then at the national levels too, and trying to message that out. Because I think until we start doing that, there's just very little awareness. And I also think there has to be sometimes a little bit of a stick component to it too, something to enforce that. And so, we have required continuing education or continuing medical education. And so again, inserting some components around climate change or sustainability into those required modules on an annual or every other year basis, as was required at least in the US, would be one way to try and foster more recognition there.
Well, thank you. And does this answer your question? I'm asking to the questioner. And one more thing I would like to ask based on the questions I've received. Well, specifically speaking, I think this may come from dentists. Well, at the hospitals or veterinary hospitals, what kind of thing should we do first? Even if we want to do something, there must be some trigger, first move. So what kind of things we can do, for example, from tomorrow on? Is there anything we can start from now on?
Do you have any
Yeah.
idea?
So yes, I
Yeah.
think that's a great point. What can you do tomorrow? What can you do right now? And so I think there's a lot of easy solutions that are simple to change. So whether it's changing your gloving technique and how often you're using gloves and thinking about what are the real risks there, that's an easy thing to correct and change. Making sure you're all on the same page for what sort of preventive practices you're trying to do across your practice. So again, you're trying to minimize the risk there. How you dispose of your waste. Where is that waste going? I think those are things that are really easy to try and dig into a little bit. We talk a lot about, in the group that I'm co-founder of, Veterinary Sustainability Alliance, is trying to get your core team together. So it's more not just doing the solutions, but actually first getting the team to understand what the issue is, and so they can hopefully become excited about it, or at least realize what might be the most pressing priority for your particular situation. Because it's not a one-size-fits-all. You know, in the veterinary space, we have come up with about 200 different possible individual easy solutions that veterinary clinics can put into place, from things like really expensive stuff, like putting in solar photovoltaic panels on your roof, to little things like changing recycling distributors or things like that. So it can be very simple task. It doesn't have to be a huge mountain to climb.
よろしいでしょうか。
Oh, there is another question about an American medical setting. Well, this is the question. The environment factors have affected human bodies. We understand that. American workers, the in a public hygiene from perspective, well, we have we have the occupational healthcare professionals. We do have those people, and there's well, what kind of roles of that occupational health professionals play in the United States? You know, I think it is really it's a bit difficult because we have different systems put in place between the United States and Japan.
Didn't have a translation there for the first half of that question, but it sounds like occupational health professionals and what role they play in this space. Is that correct?
Yeah.
Yes? Okay. So I think occupational health professionals also do a lot with environmental health in the US, at least. I don't know what the situation here is in Japan. And so certainly thinking about, you know, we live in our built environment 90% of the time. We are not out in the natural world most of the time. And so occupational therapists and health interventionists influence a lot of what we do on a day-to-day basis. I don't have specific solutions, though, of what an occupational health specialist would do in that space. I do think that thinking how the work environment is structured and the built environment is structured so that you maximize certain sustainability initiatives can be really beneficial there for how people go about their workplace every day. That's the best I have for you. So.
Okay, thank you so much. 与えられた時間が
Right, we have reached the time to finish the session, but we have the time later on for a general discussion. So thank you very much, Dr. Sander.
Now, we would like to have a lecture from Dr. Salka. So it was already, his CV was already introduced, so I would like to ask Dr. Salka to begin his presentation. So when you're ready, please start. Are you ready to start? Dr. Salka, the floor is yours.
Thank you. 本日は One Health Conference に
Thank you very much for inviting me to One Health Conference. I'm really appreciate it.
Honorable Mr. Saitaro Hattori, Governor of Fukuoka Prefecture, Mr. Masaru Iguchi, Vice Governor of Fukuoka Prefecture, Honorable Dr. Isao Kurauchi, Chairman of Fukuoka Prefectural Assembly, and President of the Federation of Asian Veterinary Association, One Health Fukuoka Office. Ladies and gentlemen and colleagues, it's indeed a great pleasure to be here, and I want to express my sincere appreciation to the organizers. And today, I would like to discuss that is UN Habitat's interventions on using ecosystem-based solutions for urban planning. The presentation will look at how ecosystem-based solutions can strengthen urban resilience and also at the same time integrate nature into city planning. It will draw on our experience from Laos to show why working with ecosystem is so essential in the context of climate change and rapid urbanization. To provide a context for climate hazards in Laos, Laos is considered among one of the most climate vulnerable countries globally. It consistently ranks very high in the Global Climate Risk Index. Its geography in the lower Mekong River Basin area exposes it to a number of climate-induced hazards like floods, droughts, and storms, and added with it the various factors like rapid urbanization, low adaptive capacity, and of course, incidence of high poverty compounds those risks. Over the past decade, what we have observed is that the frequency and severity of disasters have increased in Laopedia, and the country has experienced over 30 major disasters in the last 20 years. And what it really means is that about 4.3 million people have been affected by these disasters, and totaling loss of $600 million US. Now, this is a big number because the country, as per the last census, had a population of 7.5 million, and the country is still ranked as a least developed country. So these numbers are really very scary. Even last year, in 2025, Typhoon Wipa impacted Laos and affecting more than 170,000 people and impacting over 570 settlements. Thus, year after year, what we note that climate hazards continue to cause significant damage and disruption across the country. A study was conducted by UN Habitat in 2020 in partnership with the Ministry of Natural Resources and Environment. And we found something very concerning, is that over 50% or nearly 50% of Laopedia's population and settlements are exposed annually to at least one or climate-induced hazards. To give a brief urbanization context of Laos, Laos is rapidly urbanizing, and the urbanizing growth is about 4.5% per year, which is also one of the highest figures globally. By 2025, it is estimated that about 47.7% of Laopedia's population, they're living in the urban areas. So it really reflects the scale and speed of urbanization. So what's really happening? This fast pace of urbanization is reshaping land use patterns and altering how cities interact with the surrounding ecosystems. And planning is not being able to keep pace with this rapid urbanization. So, delving into the impacts of uncontrolled urban growth, what this really means in practice is that urban growth is increasingly coming at the expense of natural ecosystems. As urban areas continue to grow, development increasingly overlaps with the natural ecosystems that were not originally designed to absorb this type of pressure. So what we notice is that uncontrolled urbanization has encroached into catchments and wetlands. This encroachment reduces the ability of these wetlands to manage the excess rainfall and floodwaters, so essentially disrupting the natural hydrological processes. When these natural systems are lost or weakened, their proactive functions are diminished significantly. So what we are experiencing in Laos is that the erosion of ecosystem functions is now translating into higher flood risks and a greater vulnerability for the cities and communities. So leaving cities more exposed to climate extremes. So this is an example from the second biggest city in Laos, which is Kaesonpomihan city. As you know, that forests play a very important role, a very critical role in natural flood buffers by absorbing rainfall, stabilizing soils, and also regulating water flow. So this was a study initiated by UN Habitat in partnership with the government. A detailed analysis was undertaken, and we found the shift in forest cover between 2020 and 2025. And as you will see that the forest cover has significantly reduced in the Kaesong city. So this decline has been largely driven by land conversion for housing, for agriculture, and other economic activities. So this large-scale conversion and this diminishing of forest cover has really impacted and significantly weakened the natural defenses and thereby increasing runoff and making cities more vulnerable to flooding after heavy rainfall events. I was recently in Kaesong, and I was discussing with the mayor of Kaesong, and he was mentioning that how frequently during the heavy rainfall incidents, the city is getting flooded. So the case is that there is a need for rethinking about urban resilience. The trends that I mentioned make it clear that relying solely on hard, gray infrastructure is no longer sufficient to protect cities from growing climate risks. As climate hazards intensify and ecosystems continue to degrade, conventional infrastructure alone is being stretched beyond its limits. Therefore, there is an urgent need to rethink, to re-strategize how cities are planned, shifting away from approaches that work against nature rather than to build on approaches that work with nature. Against this backdrop, my talk today focuses on nature-based solutions and how UN Habitat is working with nature in the urban environment to help cities manage climate risks and build long-term resilience. So I know that there are many students who are attending, so for them, just to go through what we mean by nature-based solutions. At their core, nature-based solutions are actions to protect, manage, and restore ecosystems in ways that respond to real societal challenges, while delivering benefits both for the people and for biodiversity. Ecosystem-based solutions are a very specific and important subset of these approaches, focusing on the role of healthy ecosystems in reducing climate risk and strengthening resilience. Rather than treating nature as something separate from development, these approaches recognize ecosystems as active systems that support cities, from managing floods to improving environmental quality. In the urban context, ecosystem-based solutions allow nature to function as infrastructure, working alongside the conventional gray infrastructure solutions. And by working alongside the conventional infrastructure, it helps to make cities more safer, more adaptive, and more sustainable. Now, here is a bit of a complicated diagram, but the story is very simple. This slide essentially illustrates how nature-based solutions can be applied across different landscapes, from forests and rivers to wetlands, farms, and cities. So protecting, monitoring, and sustainably managing forests helps secure water supply, helps to control erosion, and reduce climate and disaster risks downstream. Healthy forest ecosystems, as we know, play a very critical role in regulating water flows, which is especially important for a country like Laos that are highly exposed to incidents of floods and droughts, which I mentioned earlier. Now, moving downstream, allowing rivers more space to flow naturally is another important attribute of nature-based solution. By restoring natural river corridors and floodplains, rivers can absorb excess water during heavy rainfall, thus reducing flood peaks while at the same time improving water security. In the urban areas, the nature-based solution takes the form of green and blue spaces, such as park, urban wetlands, green corridors, and water bodies. These spaces help to regulate urban temperature, manage stormwater, improve air and water quality, and deliver important health and social benefits for its residents. Taken together, this image shows that nature-based solutions are not isolated interventions, but a connected system that works across landscapes and works at the scale of the city. By protecting, restoring, and working with the ecosystems at every scale, nature-based solutions address climate risks while delivering at the same time multiple core benefits for people, livelihood, and biodiversity. As I mentioned, that it is very important to consider nature as living infrastructure. What this really tells us is that the nature-based solutions are not just environmental actions. They are development solutions that work across sectors, that work across scales. Wetlands, streams, and vegetation are simply not just green spaces. They function as living infrastructure, for example, for storing water, reducing flood peaks, and regulating environmental processes. When these natural systems are allowed to function, they work alongside the conventional gray infrastructure like roads, drains, embankments, thus complementing them and not competing with them, and thereby strengthening the performance of the entire urban system. By planning cities with nature as an integral part of the infrastructure network, we create urban environments that are more adaptive, more resilient, and at times more cost-effective in responding to the growing climate risks. Let us look into the functions of urban wetland. As we know that urban wetlands offer one of the clearest and most powerful examples of how can nature actively support resilience in cities. When wetlands are protected, when wetlands are restored, they function as natural buffers, slowing floodwaters, filtering pollutants, and sustaining biodiversity and local livelihoods at the same time. Hydrologically, these wetlands act as natural detention areas for both pluvial and river flooding, thus absorbing and temporarily storing excess water during heavy rainfall events. In Vientiane, there is a marshland called the That Luang marshland, which is located in the middle of the city. And for ages, it is providing flood protection services. And some estimates say that it is providing services equivalent to $3 million annually for the city, thus thereby demonstrating the very real economic value that these natural systems bring in. Beyond the flood management role, wetlands such as Seichampon and several other wetlands provide critical habitat for a wide range of species, including fish, turtles, and various other different animals, and even large mammals like elephants in the Lao context. So underscoring the importance of this biodiversity conservation. In the same time, these wetlands are also very deeply embedded in people's lives. Nationwide, there was a study done, and it was found that these wetlands support food and income for about 500,000 people, about 500,000 people, which is equivalent to about 10% of the country's population. So linking the health of wetlands, these ecosystems, directly to human well-being and livelihood. So these photographs are from one of UN Habitat's project site. It is Seichampon Ramsar site in Savannakhet province. It's in the middle part, central part of Laos. I know there are many of here who have been in Laos, and they must be aware of this particular wetland. And what this wetland clearly illustrates, that it supports the country's largest remaining population of critically endangered species like the Siamese crocodile. Also like the threatened species like the elongated tortoise. So beyond this flagship species, the wetland also functions importantly as a fish spawning ground and seasonal migration corridor during the wet season. So supporting fisheries within and also regionally. For some surrounding communities, the wetland is an integral part of daily life, providing an avenue to cultivate paddy, communal fishing practices, and also raising of cattle and water buffalo. The close connection between the ecosystems and livelihoods highlights how wetland health underpins food security, income generation, and long-term resilience for local population. So when UN Habitat, we are working very closely with several other UN agencies and the government. We are very much involved in working with this local population, which I will mention in one of my subsequent slides. Now there's another example. This is another wetland where we are working in Pakistan, which is about 150 kilometers south of the capital city. So the main aim is to restore a degraded urban wetland ecosystem. So historically, this particular wetland has played a very critical flood mitigation role, acting as a natural storage area for drainage flow from surrounding urban areas and reducing flood impacts downstream. For nearby communities, it is not just simply an ecological asset, but a very vital source of livelihoods. When we interacted with the local residents, they mentioned, and we found that about 40% of their annual income is derived from this wetland and stream resources through such as fishing, rice cultivation, vegetable and crop production, and livestock keeping. Over time, what has of course happened very unfortunately, that the wetlands ecological condition has deteriorated largely due to human activities, including land reclamation for construction and development, as well as mining-related activities. So these pressures had led to massive sedimentation, the spread of invasive plant species, and the accumulation of debris, thus obstructing the natural water flows and causing the water to be trapped within the wetland. So recognizing the growing flood risks and also the livelihood impacts, the government has focused on restoring this particular wetland by removing the invasive species, sediments, and waste, and thereby rehabilitating the ecological functions to strengthen resilience to climate vulnerability and future climate change challenges. So, as I mentioned, that we have been working very closely with the communities and the government. So, what we are doing is building on the broader wetland restoration efforts. The recovery of native species is a critical part of restoring the ecosystem function. For example, the native aquatic plants are fundamental to the health and functioning of this particular wetland. So by stabilizing the sediments and filtering pollutants, these plants help to improve water quality, slow flood waters, and create essential habitat for fish and other aquatic invertebrates. So healthy native vegetation also helps suppress the spread of invasive species like water hyacinth, thus allowing natural ecosystem processes to recover. Together, these functions support a rich and diverse ecosystem, with the wetland providing important habitat to a wide range of bird species, including both resident and migratory birds during the winter months. So alongside the recovery of vegetation and bird life, the restoration of aquatic ecosystem is another critical outcome of this wetland rehabilitation. This wetland supports a very rich diversity of fish and aquatic fauna, reflecting the overall health of the ecosystem. This particular wetland is home to about 177 identified fish species, including catfish, I think many of you are aware of, underscoring the ecological significance at both local level as well as at the regional level. So this fish population plays an important role in local food security, while also contributing to natural mosquito control by consuming on larvae, so linking ecosystem health directly to public health benefits. This also illustrates how restoring aquatic biodiversity delivers benefits that extend from ecosystems to livelihoods and human well-being. So these are some of the activities ongoing for the restoration of the wetland system. This is being directly carried out by the government. So it's an examples of hand-on restoration efforts to bring the degraded wetlands back to life. So managing invasive species is essential to allow these ecosystems to recover and function effectively. So there are targeted interventions to remove the invasive species, as I mentioned, sediments, debris, to clear the waterways and to restore the natural water flows and create the conditions needed for the ecosystem to regenerate and rejuvenate. As these natural processes recover, cities gain stronger flood protection, while biodiversity and overall ecosystem health are enhanced. So from an One Health perspective, this example brings us to a central lesson that urban development and infrastructure planning cannot be separated from the ecosystem they interact with. While human activities are balanced with ecological systems, if ecosystems remain healthy and continue to provide essential services such as flood regulation, water purification, and habitat protection, what cities rely every day. So healthy ecosystems in turn support improved human well-being by reducing exposure pathways to climate, environmental, and health risks. Thus, a One Health perspective helps us understand these relationships as deeply interconnected, recognizing that human actions, ecosystems' health, and societal outcomes are inseparable. Aligning urban development with ecosystem is therefore not optional, but it is indeed very essential for creating cities that are resilient, that are healthy, and sustainable for a long way. Now, I mentioned about the people-centered approaches. UN Habitat, we take a pride to deliver our projects where we're keeping people at the center, the communities at the center. So the long-term success of ecosystem-based solutions ultimately depends on this people-centered implementation. Experience in Laos shows that when communities are actively involved, not just some token involvement, but actual involvement through stewardship, inclusive participation, and local engagement, and when we honor and respect the ideas and contribution of the local community, then projects are likely to be sustained, likely to be owned, and likely to be prosper. Gender inclusion also plays a very important and critical role. Again, not a token participation, but real gender inclusion of women and children, because it also helps to bring the diverse knowledge and needs that are really important during the actual implementation. So ecosystem-based solutions should therefore be understood not only as environmental interventions, but also as social investments that enhance the quality of life, strengthen public spaces, and support community well-being. When people are placed at the center, ecosystem-based solutions become both resilient and lasting. So, as we work with the communities, we are also working with the government. So, it's very important that we maintain the balance while developing the capacity of the communities. We also work developing the capacity, the institutional capacity of the government. So in Laos, we are working with the government through targeted training, technical support, knowledge exchange visits with other countries. So these efforts have really helped us to bridge technical and institutional gaps, enabling government counterparts to move from awareness and have the capacity to actual implementation. So as a result, what we have seen that the government authorities have a lot of increased confidence, a readiness to plan, implement, and scale up these ecosystem-based solutions. So institutional capacity is therefore a critical enabler for translating ecosystem-based solutions from pilots into sustained nationwide action. And finally, if I can conclude with some lessons that we have learned from Lao PDR, what we have learned is that ecosystem-based solutions are not some abstract ideas, but practical approaches that really work, delivering climate resilience while remaining cost-efficient and, very importantly, socially inclusive. We have also learned that when communities are engaged and institutions are strengthened, these solutions can be sustained, these solutions can be scaled up, creating benefits that lies and that exist well beyond the project periods. So together, these experiences point to a very clear pathway for us that protecting ecosystems, reducing climate risks, and improving well-being can and must be pursued together. Our aim is to build urban resilience in Lao PDR by working with nature, recognizing it not as something to be replaced, but as a foundation for safer, healthier, and more resilient cities. Because the future of the cities depend on the health of the ecosystem and that sustain them. So this actually brings me to the end of my talk. From UN Habitat, we all look forward to continued collaboration on building resilient people-centered cities. Yesterday, it was a great honor to listen to Excellency Dr. Kurauchi speaking, and he mentioned something very interesting. He said, important is the coexistence of people, nature, and species. And I think that's fundamental. And what we are trying to do in Laos is in a very small way. We are trying to set some examples. There is still a long way to go. And of course, we have a lot to learn as well. Arigatou gozaimasu. Thank you.
Thank you very much, Dr. Thankar. We have a discussion time at 10 minutes. So I show you something, I talk to you something. Laosにおける都市レ
So in order to improve the residence, and you introduced EDS in Laos, so what kind of the biggest challenge or the obstacles you're facing as a UN Habitat? That is a question, one of the questions we have received. Can you answer?
I don't think I would say it is a challenge, but it is all good learning experience that we face. One is the reality, as I mentioned, that Lao PDR ranks among the least developed country. Of course, the fiscal space is very limited. There is a lot of pressure on meager resources that is available. There are many competing requests, many competing development demands, and therefore sometimes ecosystem-based solutions or nature-based solutions related projects might take a back seat. And therefore the challenge is how to make a compelling case for interventions on ecosystem-based solutions. So one of the ways that we have figured out is how we can partner with like-minded organizations, how we can build the capacity of the government at both the national and the subnational level so that they understand that it is very important, that it also brings in a lot of monetary benefit also. Maybe not immediately in the short term, but in a long-term perspective, it will help the city, the surrounding settlements to save a lot of investments, otherwise that they would have to fund with other sort of gray infrastructure that I was mentioning. So yes, one is to how to make a compelling case of these investments. And the second challenge is, again, comes from this sort of narrow economic space, is that how do we effectively scale up these interventions so that we can also engage in other parts of the country?
Okay, thank
Thank you.
you. それでは
Well, thank you. Then the urbanization in Laos and its impact on the ecosystem, yes, we can have quite a good understanding. But Cambodia and then Vietnam, well, they are sharing the same type of crisis as well. Actually, that is not your country, I understand, but do you have any idea what's happening in these countries around your country, Laos?
As you rightly mentioned, the challenges are quite similar, but maybe at different scales. Actually, I worked in Cambodia also, so I can give you some insight. And I was also involved in some Vietnam projects as well in the past. So I think the challenges are similar, but I think certain countries might have a better sort of economic or fiscal conditions to deal with it. But what I have observed that increasingly there is a greater understanding about the benefits of investment. So given an opportunity, they would like to invest in this. And I would like to say that since we are speaking here, there is also a great demand from these countries to learn from good experiences. So for example, Japanese technology, capacity building would be of great interest for these countries as well. Thank you.
Okay. 最後の一つなんですが、
This is going to be the last question. So I think this is a question concerning about Japan. So to recover the function of the degraded wetland is also the important challenge for Kyushu in Japan. So the municipalities and the citizens, what they can do living in there, what kind of the actions or behavioral changes and initiatives are required in the grassroots activity in the city or citizens level? Do you have any suggestions or advice on that?
Since I've been asked this question, I will respond to it. Actually, we always come to Japan to learn a lot from Japan. But what I would say is that from our experience in Laos, it's very critical not only to come from a policy angle, not only to come from an institutional angle, but very important to sort of inspire and mobilize the communities, the people, because as we sometimes, I like to say that giving information is good, but information not guarantees that it will transform. So information does not always lead to transformation of the way we act, the way we behave. So I think to have successful rejuvenation of ecosystems, to work in a successful nature-based solutions initiatives, very important to involve the local communities, the local citizens, and the local residents. Once they are inspired, once they understand the overall bigger goal, I think success is guaranteed. Thank you.
Okay, thank you very much. now it's just on time. So thank you very much.
So the third speaker, Professor Dr. Managi. So floor is yours. Thank you very much. To be ready. So please begin your presentation, Dr. Managi.
Welcome to Fukuoka, Kyushu. I represent local. Also, I represent United Nations. For the One Health, even though the word is easy, the policy that we are challenging is quite complex and difficult. Suppose we have three challenges. First one would be how much infectious disease we should control. This is the interaction between the species, animals, and the humans in the societies. So we got to understand the people's reaction, also the interaction with animals. So analytics for the animal's behavior, also the human behavior needed it. So even this one is quite complex. Then additional problem can be the pharmaceutical, medical, or medicine that we're gonna take. So the animal can take it, and the other species can take it, but in the end, it matters to the human health too. So it's more like the inside activity for the animals and also the peoples. Third one, this is more like the food productions. So we often eat animals. Then how much we're gonna produce and how much we are eating from the others matters. So the One Health policy reaction and also challenge is very diverse in terms of the people's reactions and the people's body inside, also then to other sustainability in general. This is pretty much very big. When we are dealing with those multiple projects, we got to deal with how much ton of the carbon, which is ton, how much people might be infected or dying, which is people's number, how much amount of the hectare that we should consider, like the ecosystem service, this is area by hectares. So unit can be different. Then reflecting on these challenges, United Nations has been working for the sustainability, for measuring what it is and what it should be using the inclusive wealth indicators. So this is a big project, so-called Beyond GDPs. So we are developing the new economic metrics for using for the actual public policy and also using for the private companies' investment. Finally, toward the decision-making to the each peoples. So One Health matter to all the people's decision-making process to other much bigger public policy areas. So I will be showing today how this so-called inclusive wealth as a beyond GDP matters to us in terms of the One Health literatures. I have been heading this Beyond GDP project for 11 years. As a urban engineering, as a technology application, and also as an economist for the economic metrics. This has been quite big attentions globally. So people show the interest, business shows the interest. So challenge we should be going is what we are measuring right now. Value can include the value for the animals, ecosystems, and climate change, as people has been discussed here today. This is a value for the natural capitals. This is a big political buzzword for the past 2 years. Second is the human capitals. It matters to the people's health and also educations. So because society has been changing for the climate change or natural disasters, people might be dying with. So people's health has been impacted. So those two people's health and education, and also the nature's value back to the economic unit, such as how much dollar, how much Japanese yen, it should matter. So we create those values to be transparent to the usual infrastructure values. This can be called inclusive wealth or comprehensive wealth. So next year, we, as the United Nations, are supposed to present to the global communities. This can be used. When now we are supposed thinking about One Health, which we care about animal health, people's health. As I said, infection disease matters to other animals and people's health. Food amount also matters. So then, as long as this is important, we can translate those amount of the ton into the economic unit, how much dollar it means. So once we are able to translate those metrics into the economic account, we can say, or we can decide, can we introduce new policy to protect the problem for infectious disease or disaster for the climate change? So everything can be accounted in terms of economy and how much it's called in terms of the cost to the value creation for people's health and animals. Inclusive wealth as a new metrics indicator for the economics. We have been calculating for more than 160 countries over the 30 years. So every year, each country has a number, like the domestic production for GDP or annual incomes. So we have a number every year. So every year, we know how much as a stock amount, value for the natures, to be comparable to the value for the human capital and also the manufacturing capitals. We take those three summations together. So every year, we have a new number. Hopefully, those new numbers will be increasing over the years. Once we can improve it, that means expected well-beings, which is subjective opinion about people's happiness, are supposed to be improved, okay? Because infrastructure, including the value for the nature and the peoples, are taken into account with infrastructures. So value creation to the society will be encouraging more well-being improvement. So that's why those indicators has been good. Past 10 years, people looking for those indicators, but people hasn't used 10 years ago because over the 30 years, even though engineering, medical, and the economics profession has been developing many indicators as academics itself, it was still too small. But over the past 2-3 decades, we start to realize the challenge required to be much bigger than people thought. For example, when there's a war for the Ukraine and Russia, people die. But we don't know how much that people's life matters in economics. Suppose we have many kids, and if they got a nutrition, if they are educated, they can contribute to the society a lot. But we don't know how much that will be. So that's why there's no enough support to them. Suppose there's a hurricane or earthquake. So much infrastructure is gone that this is a picture from Japan. But we don't count it. We don't know how much it is in the underground. So that's why we still don't know it. So the questions in the public policy making in the world was no idea what to do, okay? Those challenges has been increasing over the past 3 decades. So that's why as a nation's conglomerate, people decide to create as a UN statistics, and we are helping each other to create what the value for the negative impact of air pollution and climate change to the people's death or mental health, okay, we can think about how much parameter that means. And let's calculate one country by one countries over the decades. So this is in line with the usual infrastructure values. So value for the infrastructure called the manufacturing capital or physical capitals. This has been calculated over the 6 decades in the whole history of the United Nations. So no change in any countries. So it's exactly the same. Human capital is new, but initially only take care of the education's amount and income. Recently, we start to include the value for the health. So now we know those number too. Finally, we make it better for the natural capitals. So now we see first 2 capitals has been increasing for many decades in many countries. Only this natural capital has been decreasing for most of the countries, even the countries who has oil, such as Saudi Arabia. For many, almost all the countries, this value has been decreasing. Summation for these 3 capitals has been increasing. So overall, our well-being is good. For social challenge, this environment has been big. On average, natural capital per capita for the past 4 decades, it becomes half, okay? So 50% decrease, this is huge. So that's why Davos Congress shows this should be changed. We need an investment to those communities. In addition to the many countries number, we have our ability to utilize satellite data from the space, and we can calculate the number into the each locals. So even the 100 meter over the 2 different species, we can calculate amount for the natures, amount for the people's values. This can be calculated to the Africa too. Many public officials say no enough data for Africa. But again, from the satellite, using the Japan satellite system for the JAXA, with the help for US, Europe, NASA, and ESA, we can cover basically all the countries in the world with many different additional database. We calculate all the values. So you see that we can calculate, okay? Next, what that means to the usual decision making. I take an example from the India's. India's Delhi has been the biggest environmental problem and biggest health problems in the world from the air pollutions. People are dying, but when we are talking to the politician in India, they say no pollutions problem. Because once they said they have a pollution, they got to do it. So they say no problem. So what we did is, with a collaboration to the World Health Organization, also collaboration with UNEP, and also folks from India, we calculate what's the minus impact for the human capitals, what's the minus impact for the economic meanings. So more than 1% of the GDP has been lost, more than 1.7 million people die from the air pollutions. Then we provide the solutions. Suppose we have better transport from the electric vehicles, or we have public train. Then this can decrease the amount of the automobiles. This is a significant economic positive impact rather than complaining somebody else. So public policy in India start to change. So just changing the unit, but still matters. Also next, satellite will be the good help. Also the accuracy has been great improved because of the artificial intelligence of the AI. We utilize climate change modeling, and for the futures, we can see the future temperature change globally. And we show the most disaggregate number by areas. This is at 2050 June. This is the same times 2050s. Any area in Japan is almost reaching to the 40 degrees in the temperature, which is very hot. We used to say, if it's too hot, let's go to the northern part, Hokkaido, so we can avoid climate change. But in the future, it's no way. It's just hot. So we see that from the technology improvement, this needs to be solved. Then next question will be what we can do in realities. Because just saying climate change is important, humans' health will be important, that's fine. So we see from this bottom line for the future well-being's baseline as inclusive wealth should be improved, okay? It's easy to say it should be improved. But in realities, we have every day's well-being matters. So even as a subjective opinion, we calculate what matters to the people's happiness, people's life satisfactions, such as income, wealth, environmental qualities, family relationship. Then social science with medical expertise, also the environmental literature and economics get together well to decide what to do. But because of those good data analytics, many tech startups come out, such as climate tech, health tech. They help us to identify what will be the good solution. So for each individual decision making for a person or to the companies or regions, we see what to be spending money for each individual levels. This is very important for the decision makers. Okay? So rather than GDP for gross domestic product, now we are showing this inclusive wealth to be important for public money spending. Okay? For individuals, as I said, well-being is important, but interlinkage between human, nature, and manufacturing, those can be transparent. Because in the past, we start to say, we don't know saving people's life, how important it is compared to the animals. People have really subjective opinions, saying that people is more important than animals. But other people say oppositely, we need nature and animals as a baseline, otherwise world will be bad. But because we have a technique to make it transparent, we know what to do. So even the very local parts in Japan, such as Fukuoka's, we can calculate one health indicator which is taking account for the value coming from the animals, value coming from the environment, and value coming from the human's health. That can be academically analyzed to see what can be improved or which region is good or not. Okay? So this is the one health indicator related to the inclusive wealth. Suppose one region, such as Fukuoka, show we're going to have Fukuoka One Health Initiative or indicators. Then all the municipality in Fukuoka or anywhere, they could utilize and use in public policy says one region is better than other region, or our region is better than last year's. And what is improved and what is not improved, then we can see, all right, we need to spend 10 million yen to be used for the animal issues, and more than double money amount to be used for the health. So those decision making can be useful to say how much money we'll be spending to the futures, not just for this year, but even to the futures. If you are not dealing with those benefit analytics, people will be just saying we got to do, or this is important. This has been really time consuming, but the public output will be unclear. Okay? So as I said, this number will be transparent, and these numbers are already shared to the public officer community in Fukuoka Prefectures. So the value to the health for the animals and human can be comparable. So public need to make it face-to-face to understand first, just to understand what it means, how this number in our municipality will be different from the other regions nearby. Can we learn from the other region or not? Or this is something that we cannot change it? And discussion can be ongoing. Our colleague, Fumihiko Yokota, who is here, and I was told he presented this morning. We had developed one health indicator for all the municipality in Fukuoka that can be done for the whole Japan or anywhere in the world. Again, this is one health indicator which is academically proven that one area is better than other or not, and how much will be good or not. And the question here is, ideally, there are so many indicators that we should take account. Sometimes we do not have enough number, such as so-called one health forest. We don't know what it means, one health forest. But in the future, we can figure out, because we have a better technology to understand good forest, okay? But in the current public officials document, there's nothing like that. But we have other farmland or conserved land. So we have the number, okay? Use those available number by area to combine together to be what will be the benefit to that. So I wouldn't discuss about which municipality is better than others and how they can improve to the futures. But the point here that I want you to think is, given, suppose we know the total budget that we can think, and then we can decide what to be the area we should be make it better for the futures. Are we doing in the first 5 years to the health issues or environmental issues or animals issues? Of course, we don't say one is much better and the other two is not important. We say all are important. By even saying that, there are some slight change in the weighting. So we know what to spend and what to be benefit for that. Then future will be good because AI has been improved a lot. We have an AI startup for the sustainability we created 4 years ago. And those, our teams, we talk together to the industry groups. Okay? For industry group, we can deal with how much, what company are doing is socially good and economically good. And we calculate the benefit. They use those knowledge to talk to the stakeholders, public officials, to say, we are contributing to the societies. There's no language barriers because our AI technique can cover 140 languages in the world, which means any country's representative language is covered already, and our accuracy is more than 95%. But just checking about each country's report for average integrated report, we shows sometimes like the countries which have the blue color here, like the Indonesia or Thailand. Their corporate is somehow don't convey the message well to the public. Usually, I start from the Japanese, and people in Indonesia start from the Indonesian language. But once they translate to the English, the message and also the meaning to the stakeholder has been different, which is great disadvantage to the communities. So our technique to make it very coherent so that there's no mistake in the communications to make it better. Over the times, we are much improved. 5 years ago, people say in the company level, they got to go to each locals to check whether there's no human rights problem caused or environmental problem caused. But now we provide computational solutions that once we are creating the new apparel in Japan, do we causing some problem to the Africa or Saudi Arabia or China's? Now we shows, okay, we can make it better so that no sustainable problems to the regions. So company-wide, for the industry level, for the private companies, this can be solved. Okay? Next is more spatial problems. From the satellite data analytics, we see where is good forest that capture the climate change carbon emissions. Over the time, this has been improved. For example, satellite itself is improving, but not good yet. So we use a drone radar technology and use four-dimensional data analytics to check where is good forest. Okay, so this is the meaning for the One Health forest. Sometimes we don't know where's trees, how big it is, what kind of trees. By using those four-dimensional data set, we can calculate, okay, people thought it's only 3 trees, but in fact, we have 5 trees because 2 additional one is in the behind. So we can calculate much high accuracy carbon emission included in the carbon trees. So those better technology will be improved. Then additionally, people doubt about your data that's saying that you are true will be actually true or not. So we use a blockchain technology to say anyone can check those data. Is that verified it? And who verified it? Who checked it? And who calculated it? And who purchased those carbon credits? So those become transparent over the time. And again, technology has been improved. Okay? Finally, I'm going to talk on well-beings. Well-being is, again, is a subjective opinion about people's happiness. By plotting for the age and happiness, it's almost no relationship, so that's why people say we don't know what it means. But again, using the better technique for statistics, such as machine learning or AI, we really see this is very accurate. So more than 95% for the global citizen can be counted in this very tiny amount. So this figure's implication is following. People's income increase, of course, we improve our happiness, but after some point, our gradual increase has been diminishing, even though higher. Age matters too. Younger time, we are happy. Middle time, not really. Senior time, it's better too. Okay? So people's in the job position matters. And the environmental issue matters too. So we use those mechanics to correlate with climate change modeling. We prove that mental health in the people global are negatively impacted from the climate change to the people's mental health. This has been a great accuracy because, again, we have the number for what kind of land has been used in the area or not. So interaction of the people's mental health and actual problems and health condition can be related to the climate change and others, which is spatial issues. Mental health people's issue is more individual level. So our result for the how big for the urbanization is good or not is related to the urbanization policy for the city. Our result shows 2 bigger cities for the much urbanization area is people are unhappy. Very too much rural is also bad. Middle range for the urbanization is good for the well-beings, okay? So this justifies urbanization should be stopped in some point so that it should be spreading in the many different areas, not just having the one big area for the whole regions. We can say it because we know the future populations. So this is the case for Japan's population for 2100 for the next 80 years. We have accuracy for almost 100%. So we see population has been decreasing into the futures. So we need to realize we have to keep a good One Health forest so that they can capture the carbon and they can provide employment opportunity for the peoples, and because of carbon credit matters. So carbon credit improvement means that it's additional money to the local economies, and land will be better served, and public money can be improved. Okay, this is my final slide. So we shows better techniques such as AI. We see futures for higher accuracies than before. We know where people will be living, what will be future land use policy. Then we know that future is not that easy, and the solution should be coming faster than people thought, such as climate, animals, and environmental issues. All the issues are related to the people's well-beings. And even well-beings, we know what matters to the well-beings. So we have science-based policy-making tool for connecting the public health, environmental literature, and the social science literatures. So those can be over the time that people will be using to the futures. Then the solution can be provided by the industry. And that is my goal, and hope that One Health in the policy for Japan and many countries will be improved to the future. Thank you very much.
Thank you so much. And then we go to 3つほど質問
Actually, there are 3 questions that we have received for the professor. A little while ago, I think I have touched upon this. Well, the Q&A session will be carried out in Japanese. So Professor Sugai and Professor Managi will be answering questions in Japanese. So the answers will be translated into English. Okay. So the first question, inclusive wealth. Well, we do understand what inclusive wealth, but the GDP, well, it's not really the methodology that can elucidate as better as GDP. So I think it's rather difficult for the general public to understand. It's not going to, spread. But in order to rectify that, are there any ideas that you have? So that's the first question. Yes, thank you very much for your question. Well, this is really the new method. When the new method is introduced, you really have to have the right rationale. And GDP is, well, this is a matter of course, right? And any country use the GDP, no matter how small the country is. But in the beginning, the scholars started to use this, and nobody else used this. There was a timing. Well, the war. When the war breaks out, they, let's say, in order to win the war in next year, how many, warships or how many guns can you get? With the, GDP, you can calculate your budget. So based upon the needs of society, the method which has not been used will be used. Okay, so one country started to use this, and then the other countries follow that example. And calculate it, and probably we can win the war, by utilizing the method. So that is the reason why a new method was started to be used. Now, the same is true with the inclusive wealth. Things which cannot be covered by GDP, and actually environmental issues and economic issues, the benefits, and also the public health, and also the animal, the health issues. These things cannot be covered by GDP. In other words, GDP will come up with reverse answers, reverse results. With the break of infrastructure, the GDP will go up, right? So the negative aspects of the society could turn out to be the positive aspect. So by using the inclusive wealth, you can use this method, right? So if it's started to be used in this way, then ultimately, no matter, I think people will end up using it. GDP, I think, 0.1% of 0.01% of the people know how, what the method of calculation for a GDP. So nobody knows of the detailed method. So, if you come up with the successful cases, then you will be able to have the usage spread. I'm representing the United Nations, and I serve as this advisor to the UK, and also the Nogata and other municipalities I work with. And hopefully we'll be able to come up with the successful cases so that the use of that indicator will be encouraged.
The next is in order to maintain both the economic growth and the environment conservation, what kind of indicator and concept is needed? How we can build a consensus between these two idea or the pursuit? So I showed the satellite technology and drone for the images I showed during my presentation, and this satellite image is provided by the JAXA or NASA. This is the public organization, and we have a relationships. No matter what data that they have, that I'm able to reach them. So this is a value that is supported by the taxpayers' money, and the 4D is provided by Yamaha Motors, which is producing the two-wheelers, and they can jump to the forest fires and the affected areas by the disasters. So they have developed this technology where they can not really access. They can use this 4D technology. So in order so the public is willing to pay this technology, they can get a fund. So that we are making international rule making, and also we will do the analytics as the research organization, and the economic value goes up, and we can resolve this environmental issues. So by leveraging this technology, we can have it both together. So when it's not kind of the trade-off, or we cannot have it both, this is when you cannot see the value yet. For example, there is a plant or animal, and then if we don't understand the loss of the destroying this, and then this with unintentionally this benefit is lost, or without the understanding the value of the addressing this environmental activity. So our number of the human capital and the natural investment is calculated. So therefore, if you don't see any value, the value is very small. So the idealist says that this the indicator cannot be used, but nobody knows the real value of everything. So therefore, based upon the current value, so you have to say that this has to be protected because it's variable. So sometimes it can be applied to some issues, but some are not among some environmental issues. But my position is that we can make one success case, and then we can utilize it to spill over to other cases. So just we follow the step-by-step action. So
The next question. One health indicator has been published in the literature, but I was wondering if the indicator is carried out by country. And I mean, One Health, United Nations, and actually those people who are involved in the administration may not know it, but by country, well, this is really huge, and just like my indicator. So I think it is really important that this should be done by municipality. Basic municipality, but together with Yokota-san, we are trying to collect data. So basically, well, if you try, you can do this. If you without data, you're not able to do this. In countryside, for example. But in other countries, I think you have to narrow down the certain municipalities in a country. You are able to get more data in advanced countries than less advanced countries. But if but once people realize this benefit, the benefit of it, I think it's to be this is going to get rolling. So by utilizing satellite information, we'll be able to get the detailed information, and I'm sure that those municipality people will be even more involved in trying to understand that.
There is another question that relating to the previous questions. So the one question, One Health and the sustainability practice, that is a transparency for that, and also the framework, the evaluation has to be strengthened. To realize that, do you have any idea about the specific or more concrete the methodology or approaches to realize that? Any suggestions? Well, One Health and Inclusive Wealth are now working separately. One Health is under the World Health Organization, and the Inclusive Wealth is more close to skewed to the finances, so-called environment, the agency like UN Environment and UNESCO, UN Habitat, so World Bank and IMF under this category. But what they do is to try to create something to be utilized by everyone internationally. So then how we can make it more sustainable usage. So I think the organization of the government, private, and the government is needed. So the researchers has to bring out the new technology or new idea and launch it immediately after research is complete. So now I'm in the Urban Institute in university, and we have signed agreement with the UN organization and the major research center in overseas universities, and we publish the report. And if it's the database and the program, we publicize free of charge. So such a community of fluidity is very easy to take action. The difficulty is that the rigid this relationship among the organizations. For example, you make a report, but it takes 2 years to publicize, and it's not really usable for everyone. And IPCC, the UN, the initiative, and the biodiversity, IPBS. So I'm also representing this institution as well, and I've been writing the report for them. And I think so. It takes about 4 years to write the reports and incorporating opinions of all the countries. So then we just updating 4 years, and then we just end up in this everything just incorporated. So I think that it's very difficult to unify the idea, but I think the government, industry, and the academia more with flexible organization is very much needed. Under the COVID-19, I think the very flexible mechanism of cooperation was very much worked. So I think we would like to follow suit. So thank you, Branch, for answering all these questions. After this, all the presentation is over. We're going to have the general discussion. So this forum is more focused on the environment up until now. And also you mentioned the mental health as well, including that in many senses. You try to quantify with the indicator. I think that will be covered. These topics will be again covered in the general discussion that will come later. So I'd like to end the Q&A session in here, and I would appreciate your cooperation in the discussion later. Thank you very much.
So next is today's last presentation. As you see here on the stage, we have Dr. Sugai. So Dr. Sugai, now the floor is yours.
Everybody, this is the last talk about today's forum. Thank you very much for inviting me to this historical Fukuoka One Health International Forum. My name is Motoyuki Sugai, and I am from the Antimicrobial Resistance Research Center in National Institute of Infectious Disease, which is part of the Japan Institute for Health Security, the long name. After the super splendid talk about the previous speaker with the big data, now we remind you to come back to the wet data, so pardon me. Today I'd like to talk about antimicrobial resistance, AMR, and this title. So in 2014, the British economist Jim O'Neill published a landmark report on the impact of antimicrobial resistance on global health. According to this report, approximately 0.7 million people worldwide are currently dying. Each year due to the antibiotic-resistant infections. However, if not effective countermeasures are taken, we will expect the estimated number by 2050, 25 years from now, the annual death toll could exceed 10 million. So this number would far surpass the current number of the deaths caused by the cancer. So, and also be far greater than total deaths caused by the COVID-19. I often use this slide in my lectures to compare the antibiotic-resistant infections with COVID-19. COVID-19 can be likened to the tsunami, whereas antimicrobial-resistant infection can be compared to sea level rise caused by global warming. This is the only wording that I can use global warming in this story. Sorry, but COVID-19 was first reported in China at the end of 2019, and then spread rapidly across the country, across the world. And then the virus shows strong pathogenicity and is highly transmissible. In the early phase of the pandemic, COVID-19, infection had a very strong causal relationship with mortality. Fortunately, vaccines were developed. In contrast, antimicrobial-resistant infections often go unnoticed. The causative resistant bacteria are generally low in virulence, and these infections mostly occur in hospital settings, such as inpatient wards, and therefore remain largely invisible to the general healthy population because these infections frequently affect elderly patients. It is very difficult to clearly demonstrate a direct causal relationship with mortality. Furthermore, antimicrobial resistance is not an issue confined to the medical sector alone. It involves many other sectors, and therefore a so-called One Health response is required. Because of these reasons, we call surge of antibiotic resistance infection as silent pandemic. So this slide shows a simplified overview of antibiotic resistance countermeasures in Japan. In 2015, the World Health Assembly adopted the Global Action Plan on AMR. This was the first declaration by WHO to systemically address antimicrobial resistance as a worldwide problem. WHO also urged its member states to develop their own national action plan within 2 years in Japan. The National Action Plan on AMR was adopted in 2016. And based on this plan, 2 AMR-related centers were established in 2017. One is the AMR Research Center at the National Institute of Infectious Disease, where I work now. And the other is the AMR Clinical Reference Center at the National Center for Global Health and Medicine. These 2 centers were expected to function like the 2 wheels of a vehicle, working together to implement AMR countermeasures. So the first phase of the National Action Plan covered the period of 2016 to 2020, but its revision was delayed due to the COVID-19 pandemic. A new action plan was launched in 2023. During this period, in 2024, The second United Nations General Assembly on AMRs was held, including high-level meetings of different types of the meeting. And this is Japan's National Action Plan on AMR, and it defines 6 key objectives: the public awareness and education, surveillance and monitoring, infection prevention and control, antimicrobial stewardship, research and development, and international cooperation. Among these, our AMR Research Center is primarily committed to the surveillance and monitoring, research and development, and international collaboration. A fundamental concept underlying all these activities is the One Health approach. In other words, cooperation among multiple sectors is a central theme running through all AMR-related efforts. Based on this concept, the Japanese government mandated the collection of epidemiological data from various sectors and the annual publication of these data as a single report known as a Nippon AMR One Health report here. So as shown here, epidemiological data are collected from the human, animal, and environment sectors. In the human sector, data include antibiotic consumption and isolation rates of antibiotic-resistant bacteria in hospitals. In the animal sector, surveillance covers antibiotic use in food-producing animals, trends in resistant bacteria in livestock foods, food products, and companion animals. In the environmental sector, although still limited data available on antibiotic resistance in water and soil are also being reported. The Nippon AMR One Health report involves at least 4 ministries and the Cabinet Office, as well as public research institutes and universities from the human, animal, and environment sectors. Since 2017, this report has been published annually, and since 2024, a highlighted version with visually appealing figures has also been released. The Nippon AMR One Health report plays a unique and important role by providing an integrated overview of AMR trends across humans, animals, foods, and the environment. It represents one of the major achievements of the Japan's first National Action Plan on AMR. However, these are taken from the 2024 highlight version, mainly shows changes in the isolation rate of resistant bacteria in humans, or chickens, cattle, or swine. And in other words, the data are merely aggregated by sector and do not allow us to examine the transmission of antibiotic-resistant bacteria or resistant genes across sectors. So this is a critical limitation. Understanding cross-sectoral transmission of resistant bacteria and resistant genes is the most important aspect of the One Health approach. Today, I would like to focus on this point and introduce 3 genomic surveillance-based approaches that we are currently undertaking. The first approach focuses on food. We conducted cross-sectoral comparisons among humans, food-producing animals, and food. This study was the first to specifically focus on the cascade in which resistant bacteria colonizing livestock are transmitted to meat and then eventually to humans. So this figure illustrates the current AMR surveillance systems in Japan, organized by responsible ministries. On the left, the surveillance in fisheries and livestock sectors is mainly conducted by JBAM, which is a Japanese Veterinary Administrative Antimicrobial Monitoring Program, led by the National Veterinary Assay Laboratory belong to the Ministry of Agriculture. On the right, in the human sector, systems such as JANICE, which is Japan Nosocomial Infection Surveillance, counting the number of the isolates from the hospital. And NESID, case-based surveillance, national epidemiological surveillance of infectious disease, counting the patient number and patient pathogen data from the infection case. And JAX, which is Japan surveillance of antibiotic consumption, monitor resistant bacteria, infectious disease, trends, and antibiotic consumption. In the center is the food sector, which includes slaughterhouse, poultry processing plants, and retail meat products such as chicken, pork, and beef. Within this framework, we formed an AMR consortium and conducted various AMR surveillance studies in collaboration with experts from different sectors. So sample include the isolate from foodborne disease patients here and contaminated food. Both are collected in the public health laboratory. And also other samples from collected by the academic institutions, research institute under the Ministry of Agriculture, research institute under the Ministry of Health, and local public health laboratories. All of these isolates were analyzed using high-throughput genome sequencing apparatus at our AMR Research Center in GIS. To clarify cross-sectoral relationships, we focused on medically important resistant bacteria, specifically non-typhoidal Salmonella, Campylobacter, and Enterococcus. Non-typhoidal Salmonella is closely associated with use of the fluoroquinones, azithromycin, and third-generation cephalosporins. Campylobacter infections are treated with azithromycin and fluoroquinones, while Enterococcus infections are often treated with vancomycin. For non-typhoidal Salmonella, serotypes such as Schwarzengrund and Infantis, Schwarzengrund, Infantis, are frequently isolated from food, whereas Entitidis is most common in humans. We analyze isolates from humans, food, and animals together and examine their genomic relationship and resistance gene profiles. On the right side, here, of the phylogenetic tree, you can see several annotation tracks. The resistance genes shown here include ESB or AMP-C beta-lactamase, fosfomycin resistance, azithromycin resistance. In addition, we also included resistance genes for tetracycline, trimethoprim, and kanamycin. At first glance, you can see that the distribution of serotypes is very clear. Isolates with the same serotypes from distinct clusters, and these clusters reflect the phylogenetic structure very well. Here, the top 10 serotypes are highlighted in color. In total, we detected 70 different serotypes. The most frequent detected was Schwarzengrund, shown in red here, and followed by the Infantis here. Infantis in orange. These two serotypes were derived mainly from food and animals and tetracycline, and they frequently carried resistance genes to tetracycline, trimethoprim, and kanamycin. These resistant genes are likely associated with the use of the corresponding antibiotics such as tetracyclines, including oxytetracycline and kanamycin in hatchery and livestock production settings. In contrast, ESBL and AMP-C genes, this, fosfomycin and macrolide resistant genes were detected only in about 1 to 3% of the isolates. The figure shows the phylogenetic trees reconstructed separately for the broccoli cluster and the Agona cluster, focusing on the human-derived and food-derived isolates in the broccoli tree. With cluster A, 2 food-derived isolates and 1 human-derived isolate all carry the ESB gene BRCTXM15. The core genome SNP difference among these isolates were 6 to 10. In the Agona tree, in the B cluster, 1 food-derived isolate and 2 human-derived isolates all carry the fosfomycin-resistant gene FOSA7.2. The core genome SNP difference was 13 to 15. In the United Kingdom, a threshold of 5 or fewer core genome SNPs is often used to define isolates belonging to the same clone or same outbreak. Although the salmonella isolates in our study do not strictly meet this outbreak definition, they are only slightly more distant than outbreak strains. Importantly, we identified combinations of food-derived and human-derived isolates that were highly related and carried medically important resistance genes. Now, moving on to Campylobacter jejuni. This pathogen is a major cause of food poisoning associated with poultry consumption. We analyzed isolates from humans, retail chicken meat, cattle feces, and wild bird feces. On the right side, you can see the clonal complex or sequence type, the identification of the clone, the source of isolation, and series of resistance genes. In contrast to Salmonella, we did not observe clear phylogenetic clustering by source or by resistance gene profiles. Both the origins of the isolates and the distribution of resistance dominants were much more heterogeneous. Most isolates showed more than 23 SNP differences, suggesting that highly similar strains shared between humans and food are less common than in non-typhoidal Salmonella. Finally, I will briefly show the results of Enterococcus. Vancomycin-resistant Enterococcus, or VRE, is a major problem in human medicine in Japan, and outbreaks have occurred in several regions in Japan, also including Kyushu area. Because we specifically collected vancomycin-resistant enterococci from humans, all human-derived isolates carried either VAN-A or VAN-B. Among food-derived isolates, VAN-A and VAN-N were detected in Enterococcus faecium, specifically from imported chicken meat from Brazil. All human-derived Enterococcus faecium isolates were assigned to clonal complex 17, whereas none of the food-derived isolates belong to this complex. Similarly, for Enterococcus faecalis, human-derived isolates were assigned to clonal complex ST6 or ST179. But food-derived isolates do not belong to either of these sequence types. Taken together, these results indicate that for enterococci in Japan, food-derived isolates are phylogenetically distinct from the human-derived VRE, and no food isolates belong to the same lineage as human VRE are detected. So in summary, we collected isolates from humans, animals, and food, analyzed their genomic data, and shared the results across ministries and institutions. Our approach serves as a national model for One Health genomic surveillance, and the results are included in the Nippon AMR One Health report 2024. The next topic is I'm going to talk about the integrated AMR surveillance. For many years, the WHO's advisory group on integrated surveillance on antibiotic resistance, or called AJISA, discussed which indicator organisms and the resistance traits should be used for cross-sectoral surveillance. At the final AJISA meeting held in Utrecht in 2018, which I also attended, it was agreed that ESBL-producing E. coli should be used as a key indicator, and that surveillance should cover humans, food, and the environment. This framework is known as a tricycle surveillance. So tricycle means 3 wheels, which correspond to human and food and environment, with defined sampling package for each sector. Human isolates are from the hospital patient with the bacteremia sample, and also from the community, food handler, the stool sample, or a healthy pregnant woman stool sample. For the food chain, we use a chicken cake sample. For the environment, we isolate the sample from the upstream, downstream of the rivers, and animal slaughterhouse wastewater, and human communal wastewater. So this is Japan's first tricycle surveillance result. The prevalence of ESBL-producing E. coli was highest in human samples, significantly higher than in food and environment samples. Genomic analysis show that food-derived strains were distinct from those from humans and the environment. So in the food, only 2 versus human and environment shares 21. So most are related with human and environment, not the food. In Japan, this relationship resembles a unicycle plus bicycle rather than the tricycle. So the third topic is about our surveillance of the pathogen surveillance. In our AMR Research Center, we have been conducting a number of national genomic surveillances focusing on 13 pathogens. Here I will introduce genomic surveillance of Staphylococcus aureus from companion animals. So companion animals live in close contact with humans, and they are a kind of a family with humans, known to carry human pathogens, which are transmitted from humans to dogs and cats in households and veterinary clinics. Here we are focusing on the MRSA, which is one of the important pathogens of the AMR. So let me introduce the situation of the MRSA in human sector. MRSA was a big problem 30 years ago. MRSA in Japan was dominated by this called CC5, ST5 MRSA, which is known as the New York, Japan clone, because this is very prevalent in the New York and Japan. This is the name coming from. And they carry the 2 different important toxin genes. In the highly virulent strain responsible for post-operative infections, this clone has largely disappeared from human and replaced by the other lineages such as blue indicating ST1 or pink indicating ST8, which is more likely to cause superficial infection, skin and soft tissue infection. So compared to this CC5, ST5, New York, Japan clone, this is much lighter. And this ST5 New York, Japan clone called severe respiratory infection, sepsis, complicated with toxic shock syndrome or Pseudomonas colitis. However, when we examine the contemporary MRSA from the dogs and cats, we found that approximately 40% of the MRSA belong to this New York, Japan clone. That's amazing. In the human area, this clone already almost disappeared. And this slide shows the antibody susceptibility test results of the MRSA isolate from the companion animals, human 30 years ago isolates, and human contemporary isolates. So the color bar indicates resistance of each antimicrobials, and companion animal strains showed resistance pattern very similar to the pattern of the MRSA of the 30 years ago in human compared to the contemporary one. Much more strongly resistant to many antimicrobials. In addition, we found in the companion animal, you found very high resistance to chlorhexidine, which is frequently used as a chlorhexidine-containing shampoo in the veterinary area. This slide shows a phylogenetic tree that includes isolates from companion animals as well as humans, so mixture of the human isolates and companion animals together to analyze. We performed a time-resolved phylogenetic analysis using a tool called BEAST, which allowed us to estimate the divergence times of each cluster. As you can see, isolates from the companion animals and humans are intermingled in a mosaic pattern here, across the tree. This strongly suggests cross-species transmission rather than independent evolution. Notably, cluster SC1, this one, and cluster SC2A, this one, are characterized by resistance to chlorhexidine, quinolones, and fosfomycin, which are antimicrobials frequently used in veterinary settings. These clusters contain a significantly higher proportion of companion animal isolates, suggesting possible adaptive evolution under veterinary selective pressure. From a temporal perspective, our analysis suggests that the New York, Japan clone from human was transmitted to companion animals in the time of around mid-1990. Subsequently, in the 2000s, companion animal associated clusters, namely SC1 and ST2A, appear to have emerged and expanded. In summary, human CC5, ST5, New York, Japan clone, highly virulent clone transmitted to companion animals, and then obtained further resistance to antimicrobials and antideptics through adaptive evolution. And now, please look at this arrow. This is the isolate from the human bloodstream infection isolate, which shows exactly the same pattern with the isolate for the companion animal MRSA of the New York, Japan clone. So this is again coming back to humans. So in Japan, genomic surveillance is being implemented across multiple sectors, and integrating these data will enhance our understanding of AMR transmission and support more effective countermeasures. In the future, we will probably, the people from the environment will join this and form the real One Health surveillance, genomic surveillance system. In conclusion, the genomic surveillance is a powerful tool for understanding cross-sectoral transmission of antimicrobial resistance. So thank you very much for your attention.
ありがとうございました。
Thank you very much. So now, I would like to start the Q&A session for this presentation. Well, AMR action, what kind of information is or should be provided to general public in order to fight against the MRR? What kind of education or information is more effective? Well, a recent study show or discussed about the overuse of antimicrobial drugs, and many people said responded yes, and that yes response rate that may be higher in Japan than other countries. So that means the knowledge about the AMR or antimicrobial use that should be more well elaborated and educated for people, and particularly that kind of education should start from the elementary school level as well. Well, thank you.
Right, so the comparison between Japan and the rest of the world. Well, in the world, the Japanese situation, how is the Japanese situation? Is it good? Well, to what extent, do we have to be serious about this, measures to be taken? And from the perspective on One Health, the genetic level, or if there are anything that you can tell us about the data, genetic data, please share your information. Well, regarding the AMR, the Korea and Taiwan compared with those countries, well, actually the it's suppressed to a lower level, or maybe these sometimes the situation could be similar, so we have to take measures. In particular, VRA, the resistance, the enterococcus, it is on increase. So I think we have to take measures for that. And what was the other thing? Another thing. Yeah, that was about it. In relation to that.
And you talked about the tricycle surveillance, particularly that result from Japan that was presented. But overseas, particularly in Asian countries, what kind of results are reported, if you have any knowledge on that? Yes, at the present moment, yes, we share technologies or knowledge, actually do some surveillance activities in Vietnam as well, and also in Malaysia and in Indonesia as well. Compared to Vietnam, yes, human and food and environment, well, the level may be similar among them. And also, in regard to the AMR, and then also there are some common strains among these different sectors. So that means the same E. coli, or the same type of E. coli, seems to be circling among the human and the food and the environment. That is not the case in Japan, probably. So that means that there is quite a significant difference in regard to the situation status of MRR, depending on the countries. And I think that is quite a good survey.
This is a last question. From a practical perspective, the agricultural land in agriculture, the fertilizers, the chemical resistance. I think there are bacteria resistant to fertilizers, and it could cross-resistant to the other fertilizers. Is it possible from the genomic perspective? Fertilizers, well, the resistance to a particular fertilizer, well, to what extent has spread in Japan? We don't have the national data as yet, so we have to clearly elucidate that. And the fishery, what about the clownfish?
So from fish or shellfish, there may be some AMR pathogens may be transmissible to humans, but is there any evidence showing that? In Japan, well, the Ministry of Agriculture and Fishery, they have a kind of a J-BARM program to look at the fishing or fish farming industry. And in Korea, one time before, well, the squid or a fish sold along the beach, actually some quite highly drug-resistant, antibiotic-resistant pathogens are isolated. However, that was only in Korea, and there has been no such kind of case in Japan. And I think that is matched to the report published by the institute.
Well, so this is, well, thank you very much, Professor Sugai. This is the end of the session by Professor Sugai.